Great. Good morning, everyone. Good to see you on here. I'm Gary Harbison. I'm the Executive Director of the Missouri Coalition for Oral Health. As you just heard a second ago, we are recording the webinar, and the recording will be available through our website at a later date. We usually get those out pretty quickly. We cannot offer any continuing education through watching the recording, however. I will provide a brief introduction to the coalition, but first I wanted to thank the Missouri Department of Health and Senior Services Office of Dental Health for sponsoring this webinar and the 3 other webinars we are doing in this summer webinar series. Please see the coalition, our MCOH website main page for more information about those. That's oralhealthmissouri.org. It's pretty easy to find. And I also want to thank the Missouri Primary Care Association and Karen Dent in particular for providing CEUs for dental professionals. Thanks also to Missouri Department of Natural Resources for providing CEUs for water operators. Please watch for a post-webinar survey and please complete it. If you do not get it, check your spam folder. We are aware that some people are having issues with our info at missourioralhealth.org emails going into spam folders. So if you're not getting stuff, get in there and check. I also want to thank all of our speakers for sharing their expertise and experience today and taking time out of their busy schedules to be here. We have around 120 people registered for this. I don't think they're all on yet, but the numbers are growing as I speak. And I want to thank you all for registering and for being here. We hope this is a useful session for you. And I want to note that we'll be using the chat feature for questions, and we'll do our best to get to all the questions, but we can't guarantee that. Generally speaking, if you could hold your questions until after all of the presenters have completed their presentation, that would be good. If you've got a burning question, go ahead and put it in chat. We'll try to get to it as we go along, but we're watching the time closely. So the Missouri Coalition for Oral Health is a nonprofit dedicated to improving Missouri oral health. We only have 4 staff members, but we have members throughout the state who work together to meet the many oral health challenges of the state of Missouri. And give me just a second here. I just had a little computer glitch. We are supported by memberships, donations, the Health Forward Foundation and the Missouri Foundation for Health, and by some agreements with the Missouri Department of Health and Senior Services. Most available numbers indicate that Missouri has tremendous challenges to achieving good oral health. Rural areas of the state in particular have limited access to dental care, and that greatly impacts the health and well-being of Missouri residents. That's also true for certain urban areas in the state. And it's important for everyone to understand that maintaining good oral health is essential to overall oral health. Poor oral health can interfere with work and school, and it actually can lead to death. People are used to kind of generically thinking about oral health as maybe about something that's a little cosmetic, but it actually is a core health issue. And there have been instances in which people have died from untreated dental conditions. And we certainly don't wish that to happen to anyone. You can find more information about the coalition on our website and more information on the numbers, the available numbers from the Missouri Department of Health and Senior Services website. If you Google Missouri Oral Health, you should be able to find both sites pretty easily. So at this point, I was going to introduce Gwen, who is the Community Water Fluoridation and Dental Sealant Coordinator with the Missouri Office of Dental Health, but she has lost her voice, and that is a problem when it comes to webinars. So she's on here, and Gwen, we're all hoping you feel better soon and get back to talking a lot. Gwen is really an excellent resource for all local people. And she works on fluoridation issues locally and provides a lot of resources to people. And so if you haven't met her in the past and need to reach out, her, please do that. Instead, I am going to hand off to Ashley Herman, who works with the coalition. She is the Community Outreach and Project Development Director for the coalition, and she is going to lead us into our next section. So welcome, everybody, and Ashley, you have the floor.
Thank you, Gary. And again, I just want to say welcome, and we have a great turnout for today's webinar and some great speakers lined up for you. So without further ado, our first speaker today, talking about community water fluoridation and health literacy, is Tuka Zakai. She holds a Master's of Public Health degree and is the manager of fluoridation and preventative health activities with the American Dental Association. So Tuka, if you would like to share your screen, the floor is yours.
Wonderful. Thank you so much. I want to thank Gwen and Gary for inviting me today, and for all of you taking time in your afternoon to be here on this webinar. Hopefully it's informative. I kind of want to start by saying, a lot of the public health efforts happen at the local level. We've seen that this year and, the last 2 years almost more than ever. And it still continues to show that local decisions and local actions are going to impact the health of the community more than any other entity. But the American Dental Association has the opportunity to work with experts, not just all over the country, but the world, to get the best information, interpret the evidence, work with researchers to help you, dental providers, water operators, water engineers, to do the important work of protecting the health of the communities you serve. And thank you for doing that, for doing the work every day to try to give the best health to your own community. And today we're going to talk a little bit about community water fluoridation and health literacy. There's a lot of confusing evidence about fluoridation and misinterpreted evidence that's been spread. And we want to just kind of clarify where the best evidence is and what some recent science that I know your communities have been, getting information about isn't exactly rooted in a public facing way. So we're going to dive into that. And then if you do have any questions, please let me know. This is just a general overview of some of the common misconceptions and how to kind of find the best information. So as a note, community water fluoridation is the controlled adjustment of fluoride that naturally occurs in water. In fact, some communities have higher levels of fluoride in their water than would be recommended for that daily exposure. Now, the fluoride that is in water, especially that is treated for optimal water fluoridation as a program, is at a very low controlled amount for that chronic exposure. It is lower than any levels that would have adverse health effects. And in some cases, when it comes to water fluoridation, and we hear about folks that are spreading information like you're going to get fluoride poisoning, one would actually have water poisoning and have too much water before it comes to something like an accumulation of fluoride. So that is already something that is being misinterpreted. We can actually have too much of anything. You can have too much of water. And for the fluoride in water, it is at such a low controlled amount, which I will dive into. So fluoridation of community water is the single most effective public health measure to prevent against dental decay. Gary was sharing earlier how dental decay is a health issue, and dental caries are the #1 chronic disease in children. It's one of the reasons for the most missed school days. So it's definitely going to be something we should prevent at the population level if we can. And water fluoridation is a very effective way in preventing dental disease at the population level. And in some communities, because of COVID-19, when dental offices weren't able to open their doors and some people did not have proper home care or dental hygiene, community water fluoridation was one of the only defenses against dental decay and the only community health opportunity when other sorts of community dental clinics or mobile clinics were closed. So it is such a powerful and unique program. And it's recommended currently at 0.7 milligrams per liter. It's sometimes also said 0.7 parts per million. And it is hailed as one of the 10 great public health achievements of the 20th century. So this just kind of sets the stage of, this is an effective program. There's been over 75 years of research in this. The amount that has been in the water has been adjusted in recent years in 2015 because there are other products that have fluoride as well. So it wasn't that the previous recommendation, which was 1 part per million or 1 milligram per liter, was too much. It was that we saw that there were other products now that had fluoride, and they decreased the recommendation in order to account for that. So it's not saying if you're using fluoridated products, you shouldn't have water fluoridation. It's already been adjusted to control for that. And currently, the EPA standards for fluoride in drinking water. Now, this is for naturally occurring fluoride. As I was saying, there are some places that have higher levels amount of fluoride than what is recommended for community water fluoridation. So the maximum contaminant level is 4 parts per million, and the secondary maximum contaminant level is 2 parts per million. Now, what is the side effect of having these levels? It's usually severe enamel fluorosis. It's an aesthetic effect. It's not necessarily a health effect. And the Community Preventive Services Task Force, they recommend community water fluoridation to reduce tooth decay. So if the question is who is recommending this or who should I listen to, the community guide of the CDC offers recommendations for the community to adopt, and one of them to improve oral health is community water fluoridation. There's some statistics in the bullets in the image attached, but a big one is after water fluoridation began, communities saw a median increase of 15 percentage points in the percentage of caries-free, and that's cavity-free, children compared to communities without water fluoridation. And even today, we see that community water fluoridation as the public health program of water fluoridation continues to prevent dental cavities by 25%. So it is a very effective and safe program. There are currently some targets for water fluoridation at the community level. I'm going to direct us to the Healthy People 2030 goal, which is 77.1% of the population. We want to increase the proportion of people whose water systems have the recommended amount of fluoride. And that is including those that have too much fluoride as more than what is recommended, to have it controlled back to the optimal amount. And I hope that that's clear. I also wanted to bring up this tablet system. I will say that your state is still working on getting some minimum design standards for community water systems. So this is currently not approved, but as I know there's a lot of water engineers and water operators and managers on this call, there is this new technology with the sodium fluorosilicate tablet system, and it's really awesome new technology, especially for smaller communities that have smaller, more rural water systems. And it's an opportunity to distribute fluoride to smaller communities. That's about populations of 10,000 or less. And it's very cost effective. All the materials are made in the US, and it's a tablet rather than a liquid fluoride. In terms of where to get more information about fluoride, in terms of this background information and links to quality evidence-based materials, there's this All About Fluoride one-pager. If you go to ada.org/fluoride and then hit resources, this will be the first link there. And I can also send it, the team can also send it out to participants from today, I think. But here's just kind of a 2-pager on some fast facts, and then it's interactive. So if you open the PDF, it'll take you to other links to learn more information about different topic areas. So I can send that out later, which is a fun little tidbit. I also know that Dr. Kumar is going to talk more about this soon, but I know this is also something a lot of folks have been sharing, and I just wanted to make something a little bit clear about this National Toxicology Program's monograph. So the National Toxicology Program, they've done 2 draft monographs on fluoride exposure and neurodevelopmental and cognitive health effects. And their second draft monograph classified fluoride as a presumed neurotoxin. However, the evidence that they used and the way that they analyzed the evidence was actually, as the National Academies of Science, Engineering, and Medicine said, was worrisome. They had worrisome inconsistencies, and they actually charged them with doing a third monograph. And rather than a third monograph, at this point, they haven't released anything. And it looks like they'll be releasing what's called a state of the science, where there is no classification of fluoride and neurodevelopmental and cognitive health effects. This is because a certain study was being weighed inappropriately. There's also some other reasons, and again, Dr. Kumar will dive into that, but I wanted to introduce this because I know it's something that has been circulating. So the National Academies of Science, Engineering, and Medicine Committee advised the National Toxicology Program to make it clear that the NTP draft monograph cannot be used to draw any conclusions regarding low fluoride exposure concentrations, including those typically associated with drinking water fluoridation. I highlight this and I read it out loud because you may be faced with someone bringing this NTP report to you that is a draft that has been deemed as inappropriate to go to its final form. And the National Academy specifically stated that this monograph, even in its draft form, it does not have the kind of evidence that would be used to impact water fluoridation as a program. Not talking about the levels of fluoride that you would see in drinking water. So for fun facts like that and more FAQs, I highly recommend you check out our Fluoridation Facts 2018 edition. It was put together by the American Dental Association's National Fluoridation Advisory Committee, and it has kind of question and answers on fluoride. If you have any additional questions that this book cannot answer, my email is at the end of this presentation, and please contact me if you have any questions. If I can't answer them, I probably know someone who can. And that's a lot of what we do, is finding the right experts to answer your questions. But new research can often lead to misleading headlines and conclusions. And it's really important to use evidence-based practices to share the true findings. Unfortunately, this just does not happen in media. This does not happen when it comes to public health communications. Public health, even before COVID, was the #1 reported topic. And there are really misleading headlines sometimes that don't reflect the research. And I'm not saying fake news or anything, because I don't think that's necessarily what it is. I think it's just misinterpreted, and it's always so important to look at what the evidence is really saying. I kind of have an example of that with a study that I know has also been circulating in your communities. So I wanted to respond to those here with the JAMA, so the Journal of the American Medical Association Pediatrics. They released an article in 2019 that was investigating an association between fluoride levels in the urine of pregnant people and their children's IQ 3 to 4 years later. And the findings only found a gender association between boys. As fluoride increased, there was a statistically significant decrease in IQ. There's no association in girls. In fact, when you look at the graph, the girls' IQ is increasing. I want to say there were many limitations to the study. The fact that there was that gender difference in IQ was something that already was inconsistent with previous studies. There was no general IQ difference. So there's a paring down of the evidence to see what kind of statistical significance there is. But the fact that it hasn't been replicated, that IQ studies are already not as reliable unless they are replicated, that the fluoride exposure cannot be generalized to water fluoridation. Really, the research implication is that there are no conclusive findings. However, we always recommend to continue research. We want to follow the evidence. There isn't anything more important than just making sure that these public health interventions are the best for the health of the public. But this study does not impact that. In fact, one of the authors of this study even says that if she were pregnant today, she would still drink fluoridated water. So it's a standalone study that hasn't been replicated, and it just hasn't been, it's not conclusive of anything. But of course, these are the kinds of headlines that came out. I mean, even when this study came out, I get a call from my sister saying, oh my gosh, I was listening to NPR and I just heard that fluoride is going to decrease my child's IQ. So that was a huge leap from what the evidence was saying and what this one study found as an association compared to the larger body of evidence. And these kinds of headlines with the skull and bones and the the scary math and all the things that can lead someone who's just clicking a link to jump to a conclusion, that's going to possibly actually adversely affect, it's going to change their choice from being one rooted in health to one not rooted in health because of something like this. I don't know if that made sense, but it's actually guiding the public to not make the best decision for their family's health. This same study, when it came out, there were statements about the study's limitations, statements that reaffirm the safety of community water fluoridation by these listed organizations. So not only do we have associations here for dentistry, for pediatrics, for medicine, for environmental health, but also leading universities, environmental toxicology groups, all of them reaffirming the safety of water fluoridation. But what is going to influence the general public? What happens at the community level? More likely, they're going to be exposed to those news articles than the association and university statements. And a lot of these links here still link it to the one study. But that one study is also not in context of the general range of studies that look at fluoride exposure and IQ and don't see an association. So there's some disconnect between what the experts are saying and what's happening in the media. So my recommendation is to read the original research, see what leaders in research are also saying about fluoride, ask questions about it. Don't take it for its face value. And if something does seem concerning, ask. I mean, when this study came out, I asked a lot of questions too. I looked at other research and I followed the leaders in evidence that can compile the body of evidence. I also would recommend, if you are sharing things with others, it should be written at a 5th grade reading level, which a lot of the news articles were, but the association statements weren't. So asking these pediatric groups and dental groups to also release things. And we release statements that are health literate and also explaining the evidence. And it's just so important to have that public health literacy when sharing information. So that is my presentation. I see a couple questions. Maybe not. Okay. I see one about printing the PowerPoints. I don't have this PowerPoint as something that is shareable, but if there's any certain information you would want from it, please email me and I'm happy to send it your way. So that is my email on the screen. Great. So at this time, I would like to introduce Dr. Jay Kumar, who's going to dive more into the evidence and more eloquently explain what's going on in research. He is the California State Dental Director, and I'll let him have the screen.
Thank you. Good morning, everyone. I'm going to share my screen. I hope you can see my presentation now. Thank you, Ms. Okai. Thank you, Mr. Harbison. Thank you, the coalition, for inviting me. I have been asked to talk about the recently released National Academy's review of this draft report. So I usually don't look at individual studies until it's reviewed by some of these committees, because there are so many reports coming out, and generally these reports are subjected to reviews by special committees, and we want to wait till what the committee says. It's not the individual's opinion, it's usually the consensus report by these committees that are important. So Ms. Okai talked about the community guide. So in our state and in many states and local governments, we look for guidance from community guide. It's a task force set up by the federal government to review the evidence and come out with reports. And they have recommendations about preventing tooth decay, and they're at the community level. So there is a similar task force for individual level. So we look for guidance from these task forces and committees. So my favorite, I've been asked to talk about this National Toxicology Report about the neurodevelopmental and cognitive health effects, mainly children's intelligence. And I want to say about these studies that keep coming out, my favorite is coffee and health effects. I don't know if you have been following over the last 30, 40 years, every other month there is a report. One report will say coffee is beneficial, and the next report will say coffee causes X, Y, and Z. So that's why, these are all based on observational studies. That's why we want to wait for a committee to come up with consensus statements about these kinds of reports. So the NTP, the national, concluded that it's presumed to be a cognitive neurodevelopmental hazard to humans. That is, mostly they looked at children's intelligence or IQ and ADHD. There are only a couple of reports, so they decided to focus on children's IQ. So I'm going to review a little bit about this report, more importantly, what the National Academies Committee stated and why they came up with their conclusion, which basically rejected this report. So there have been many reports on fluoride in drinking water. I've been part of many of these reports. Some are about the benefits, some are about the hazards. So I was part of this National Research Council report, fluoride in drinking water. There's an EPA report. And about this national toxicology program, it was reviewed by as I said, by the National Academies. And I was a reviewer of that report. Not the committee member, but I reviewed and offered my comments. And there have been many international reviews from Germany, Canada, Australia, Ireland, and New Zealand. So all of them have concluded that there is not enough evidence to support this conclusion of presumed neurodevelopmental hazard. So the National Academies review committees report aligns with many of these international reviews. So this is how NTP determines if a substance is toxic or not. And it's based on what they call level of evidence. They use both animal studies and human studies. So if the level of evidence is very high in animals and also very high in humans, generally is considered as a known toxicant. So lead, mercury, and some of those things. And even if there are no animal studies, but if it's based on good, sound human studies, they can conclude it as known. So when it came to this fluoride, there have been many reports, but interestingly, it was concluded that most of the reports were not informative. And so the NTP, the National Toxicology Program, relied heavily on human studies to decide that this is a presumed neurodevelopmental hazard. And actually, and the National Toxicology Program conducted its own animal study, and this is exposing animals up to equivalent of 4 parts per million, that is the maximum contaminant level. So when they studied in the US using a standard protocol, basically they didn't see an effect. At these exposure levels, we observed no exposure-related differences in motor, sensory, or learning and memory performance. So this was the result of the NTP animal study. So usually animal studies are informative about how, how it works, how a substance is toxic. So so the NTP study showed that it was not toxic at this level. And so, so in 2019, the NTP issued a report that said there is consistent evidence and their determination is based primarily on higher levels of fluoride exposure, that is greater than 1.5 ppm in drinking water. So this is very important. So we fluoridated 0.7 ppm, and that is the exposure. And intake, what is ingested, what is taken in is different in different countries. So most of the studies, when it comes to children's intelligence, they are from China. There are about, say, 75 studies or so overall. Out of that, only 3 studies are outside China, India, and Iran. There are 2 studies from Iran, maybe 10 studies, but most of the studies are from China, and these are conducted in poor rural areas of China, what they call endemic fluorosis. So very high levels of fluoride. So these communities are different because of the difficulty, because of the rural nature. And usually the water consumption is 2 to 2.5 times higher in these communities when compared to the US. So something important to remember. So the National Academies reviewed this. This, I call it round 1, the first report, and they asked them to conduct further analysis. So they said the committee does not, does not believe that the NTP has adequately supported its conclusion of a neurodevelopmental hazard. So they asked them to do further analysis, and one particular analysis is called meta-analysis. So I'm going to show you what this meta-analysis is. They asked them to update a previous meta-analysis conducted by Choi. So this is that analysis. So you're all familiar with calculating, say, average height. In a classroom, say, you line up all the boys, you measure the height, and you come up with an average or a mean. So in a meta-analysis, it's slightly different. Instead of individuals, they take all the studies, and it's basically the average of average reported by all these different studies. And you see a central line which says 0. That means 0 effect. If all these boxes are in the center, you say no effect. Usually, if it's on the left, it says it. In this particular, say, in this case, it is decreases IQ. If it's on the right, you say it increases IQ. So Choi published this and concluded that there is possibility of adverse effect, but there are a lot of deficiencies in the study. They are small, they're rural, high fluoride, all of these, or most of it, maybe 1 or 2 in low fluoride, but majority of them, they're all in high fluoride area, comparing to 1 part per million around. So they said, and this, what we call, it doesn't adjust for some of the other variables. There may be differences between high and low fluoride area, and they didn't take into consideration. So they said future studies should focus on addressing some of those concerns. So NTP, because the National Academies asked them to update that, so they updated, and they found something very similar when they added more studies. So in the NTP meta-analysis, they added, I think, 19 more studies instead of 27 that Choi reported. It was 46 studies, and they concluded that there was some consistent and robust results. And then, because it's a group level exposure, that's considered the weakest evidence. So usually you don't make the causal association based on those kinds of studies. So you need individual level measures of exposure. So here, they were able to find 6 studies of individual level, that is fluoride measured in urine. And based on that, they said it decreases IQ by 1.4 per 1 milligram increase in urinary fluoride. And that they said this effect is small. The magnitude of the effect is small. So whenever the magnitude of the effect is small, you have to always question whether it is a causal association, whether it is an association or whether it is a causal association. So, these are the studies that NTP used, and there are some problems with it. First one is the unit. So they used 1 milligram. So the difference between fluoridated and non-fluoridated area in a Canadian study was only 0.3 milligrams, not 1 milligram. And even if you use 0.5, it basically translates to 0.7 IQ. And so that's one of the reasons why they said the magnitude of the effect is small. And the other issue was there, you have, in a meta-analysis, we have to use only one publication out of a study. So if there are 3 publications out of one study, then you are supposed to select only one study. So I wrote to these 3 authors from China, Dr. Zhang, Q, and Yu, because I saw that they were all conducted in the same city of Tianjin. It's the same group of people, and they said, yes, these are all from the same study. So you, once you eliminate these 2 other studies and limit it to low fluoride areas, this difference becomes even smaller. Actually, it will move towards positive depending on what data you select. So that's one of the reasons I think what the National Academy said, that there are some worrisome inconsistencies. The data presented in the meta-analysis, they had concerns. So ultimately, they said the monograph falls short of providing a clear and convincing argument that supports its assessment that it is neurodevelopmental, that fluoride is a neurodevelopmental hazard. And as Ms. Okai said, they said it should not be used to draw conclusions about fluoride levels in drinking water. So they wanted NTP to make it clear. So here is a paper, one of the leaders in meta-analysis, Matthias Egger, wrote, Spurious precision. You can get very consistent association in many studies. And this is about smoking and suicide. So if you look at all these studies on smoking and suicide, virtually almost all of them show a positive association and a dose response. More cigarettes they smoke, more likelihood of committing suicide. But there is no mechanism how smoking causes suicide. There is no way smoking could cause. So what he says is you have to be especially careful when you do all these meta-analysis, because there may not be a causal association. And he cites this and couple of other studies as examples. So there are, as I said, there are several other reviews and papers from Sweden, Germany, Canada, Ireland, England, Australia, New Zealand. All of them have said that it's best summarized by Guth from Germany. He has published 2 reports on this. In 2021, the final report he published. In conclusion, based on the totality of currently available scientific evidence, the present review does not support the presumption that fluoride should be assessed as a human developmental neurotoxin at the current exposure levels in Europe. So that is the current status And now, because as I said, these are all based on observational studies. So the question is, should we do more similar studies or different kinds of studies, animal studies? So the different research groups are exploring. There is a webinar coming up organized by the International Association of Dental and Craniofacial Research to explore this topic. So I'm going to stop there. And if you have any questions, I'll be happy to answer.
Thank you, Tuka and Dr. Kumar. We are a touch ahead of schedule, so if there are a couple of questions that have come through, we could take those now. I'm not seeing anything in the chat. And again, you're welcome to type those questions in the chat at any point in time. So while we wait to see if there's a question come in, I am going to go ahead and introduce Julie Beckman. Julie is the manager of the Office of Dental Health within the Missouri Department of Health and Senior Services. And she is going to lead our water operator discussion today with our various panelists. So Julie, I will turn things over to you.
All right, thanks, Ashley. Thanks, Tuka and Dr. Zakat and Dr. Kumar. That was very informative. I've seen both of you speak before, and I learned something every time, so I appreciate it. So first off, I want to introduce to you the water operators that we have on our panel today. I'm sure they're very excited to be here. I'm excited to hear what they have to say. First off, we have David Harris. He is the Public Works Director and the Chief Water and Wastewater Operator in Charleston at the Charleston Public Works Department. Then we have Frank Shovlin. He is the Utilities Director in Park Hills, Missouri. Met Frank whenever we awarded him his reaffirmation award. So it's good seeing you, Frank. And then last but certainly not least, we have Roger Sullivan. He is the Water and Wastewater Superintendent in Marceline, Missouri. So thank you, gentlemen, for being on the call today. David, nice to see you again, too. We also presented you with an award just a few weeks ago. So good seeing you, too.
Thank you.
All right, so I will just go ahead with the first question, and I'll ask the question, and then I suppose if you guys want to fight over it, otherwise I can ask somebody to answer, and then you can each three have a turn if you'd like. So the first question is, what do you do if your readings are outside of the optimal range of 0.6 to 1 parts per million? David, you want to answer that?
Sure, I'll give it a try. But basically, every day we go out and we look at our equipment a couple times a day throughout the day, and we test our water in-house for fluoride at least every other day. So if it gets out of range, basically I'll go up there and I'll tweak the pump a little bit to one way or the other, but it's very seldom that happens. We use pulsafeeder pumps and do a real good job. About the only time it gets out of range is if one of the operators were to change the tubes over to a new barrel and get a little air in the line. And that would be the only time that we would get out of range. And then it's a matter of getting the air bubble out of your suction line and go from there. But all in all, it does real well. And as far as getting out of range, if it happens, I can move the pump levels up or down just a little bit to get it back in line.
All right, thanks, David.
Mm-hmm.
Frank, Roger, you have anything to add to that?
Yeah, well, as David says, we run a peristaltic pump just because of the air bubbles that would it would lock it up and lose its prime. We don't have that problem. We check ours twice a day. We're probably a little bit more. I'm all about testing. I want to know what's in the water, what we're sending out. So we stay in that range all the time. I mean, since I've been here for a year and a half, we haven't been out of that range once. So we're right there. So it's all in maintenance, I believe.
I believe you're right.
All right, thank you, Frank. Roger? Oh, you're on mute, Roger.
There we go. There we go. I can talk now. And I have no problem doing that.
That's what I've heard.
Yeah. We have a no-touch peristaltic system, and we test the water at least once a day. Of course, we only operate about 10 hours a day, and it's very consistent. Of course, our water is lake water, so it has a low natural fluoride in it. So we keep it at about the 0.7 level, leaving the plant at all times. And our system is very consistent. And it's an easy, no-touch system.
All right, great. Thank you, Roger.
Yes, ma'am.
Okay, our second question. If a piece of equipment breaks, how do you handle replacing it, and who do you notify that you are temporarily not fluoridating? Frank, you want to take that one first?
Sure. We have a spare parallel or standard pump available. I mean, within 10 feet of it. My operator, he usually, if something happens, we'll call. We do maintenance on them pumps. We replace the tube on them once a year. We don't wait for them to break. I think Roger made a statement there. We actually pull right out of the mine shafts here in Park Hills. So we're kind of a unique system here. You know, we actually have in our water 0.3 to 0.4 natural fluoride. So for us to get up to 7, we feed very minimum fluoride to make it there. So very seldom do we, you know, equipment breaks. We try to stay up on top of it. So that's about it.
All right, thanks. And who do you notify if you're temporarily not fluoridating? Does that ever happen?
No, we have not yet, but I mean, if thing, we would definitely call the Department of Natural Resources, the public drinking water unit down there in Southeast region. We would get a hold of them.
Okay. All right. Thank you, Frank.
Mhm.
Roger?
Yes, well, I'm kind of like the same way. We carry a peristaltic pump in stock. If a pump goes down, if a tube breaks, which never happens because we change them out, like he says, once a year. And if we were to go below the levels prescribed, we would contact the DNR at the Northeast region, so that we wouldn't, you know, but fluoride's not really a big concern of ours because it just keeps clicking along.
Okay. Good to hear. Thank you, Roger. David?
I'm the same way. I also keep a spare pulsafeeder diaphragm pump on hand. If we need it, we have it. But in the past 20 years, I may have gone through 2 pumps. I've got 1 extra. So the pumps really last a long time. So we don't have any trouble with them at all. As far as notifying anybody, typically we'll realize that the levels are going down before it gets out of range. But if they were to, then I would notify the DNR also, just give them a courtesy call that this has happened.
Okay. All right. Great. Thank you. All right. So this next question, what do you do if someone asks questions about fluoridation and the benefits? Roger?
Oh my. That's a can of worms.
I'm glad you got that one first, Roger.
I planned it out that way.
Whenever, most generally when I get a call on fluoridation, it's some mother saying that she don't like the fluoride in the water because her children are getting dental appointments and fluoride at the dentist. They're getting fluoride toothpaste and fluoride rinses, and they don't need the extra fluoride in the water. And I say, yes, ma'am, I understand where you're coming from, but how about the 75% of the children in this area that don't see a dentist every 6 months? They don't brush their teeth twice a day. They don't have fluoride rinse. So you want to deny them any fluoride whatsoever to help their teeth? And then I get the occasional call of somebody ranting and raving, fluoride's a poison, get it out of the water. We don't need it in our water. And I try to be very calm and polite and say, yes, it's a poison, but so is everything else that we put in the water. There ain't one thing that we don't put in the water that won't kill you if it's in great amounts. And I said, okay, we take the fluoride out. Your neighbor calls and says, I don't like the chlorine, it's a poison. Okay, we take the chlorine out, and so on until you're drinking straight lake water. Do you want that? And usually they hang up the phone on me.
Well, good. Sounds like you handled that very well. All right, David?
Yeah, I haven't had many questions about fluoridating in Charleston. I've been here for the past, I've been the chief operator since '91, but the few I have had, I tell them that there's only one reason that we fluoridate, and that is to prevent tooth decay. There are a lot of kids and people have the luxury of going to dentists. Some don't, as Roger said. So this is in Charleston being a low income community. I think it really benefits a lot of children, especially. So I try to get that point across to them the best I can, and it usually suffices. Yeah.
Good. All right. Thank you, David. Frank?
Kind of like David said, we're unfortunately we're a low income area too. One of the lower incomes in St. Francis County, and it is a benefit for the kids. I kind of learned a lot when I first came here. My mayor asked me, the council said, hey, how can you save some money in your department? Well, boy, did I open up a can of worms when I said, well, we can take care of this, continue to fluoride, and it's a secondary thing, through from my former job. And I said, we really could save some money there. Well, that just opened up the door. But it really opened up my eyes. I mean, it really does help the kids and the elderly and stuff like that. So I really don't get a lot of questions. We did have a lot of questions come out, and the benefits of it. And I tell people, kind of do some research on your own. I mean, everybody's got these smartphones nowadays, but I try to show them, take them down if they want to go see the equipment. I'll take them down. I'll try to educate them the best I can. Seeing's believing. And yeah, that's how I get to meet all you girls.
Yes, thank you. Well, of course, the short answer to that question was call Gwen. So I'm glad
Call
that you guys
Gwen.
expanded on that. So
Yeah,
Gwen, I'm sure appreciates that too.
Yeah.
We are always here to help. So as questions come up and issues come up, we are always glad to help. So we'll be happy to come out. When I say we, I mean namely Gwen, but all of us are always happy to help you. And Dr. Deaton is obviously too. So thanks for that. Okay, so what does it cost your system to fluoridate? And how many people or connections does your water system serve? So David.
So our budget for our major chemicals for Charleston is $48,000 a year. Now that includes chlorine, hydrofluorosilicic acid, and caustic soda. So I figured about just for fluoride, the fluorosilicic acid, we spend about between $6,000 and $7,000 a year for that chemical. So it's not much at all. We have our population here in Charleston is about 5,400. We have about 1,400 connections. As far as the cost of that, like I said, about $6,000 or $7,000 for the fluoride, and then the testing reagents that we use, we spend about $3,000 a year, but that also includes chlorine testing reagents and so forth. So it's for the cost of fluoride, it's under $10,000 a year.
All right, good. Frank?
Yeah, ours is a little bit more. We got we're about 9,000 population. We get about 3,100 connections. We spend anywhere from around 30 to 35,000 a year on fluoride. I'd have to say the equipment, thanks to Gwen, helped us out, and we won't have to worry about that for years now. But yeah, we, you know, I know David said what they budget, we budget about 75 to 80,000. We're probably gonna have to bump it up a little bit. Chemical, chlorine and all that seems to be going up higher. So I don't know if fluoride's gonna follow that through what's going on in the world, but we're gonna continue to keep feeding it no matter what we gotta do. So it doesn't really cost that much to feed it, and it helps. It really does help out a lot.
Yeah, that it does. Before Roger gives his answer, I mean, every dollar that you guys spend on water fluoridation is about $30 saved a person, you know, per year in your community. So, you know, you can look at it that way, all the money that you're saving your community.
Yeah.
So Roger, what's your,
Yes,
You
ma'am.
guys-
Well, our budget for water chemicals is about 150 to 160,000 a year. Of course, we're surface water, so we have a lot more chemicals that we have to add to treat the water. I broke my fluoride down to a 1 day, and it cost me 2 cents a day per customer for fluoride. And that's taken the testing equipment and the fluoride itself. And we service a population of about 2,300 here. Plus, we sell into rural water districts in Sheridan and Lynn County. So we actually service between 8,000 and 10,000 people, and we pump somewhere between 500 and 700,000 gallons of water a day. So and our natural fluoride in our lake is also around 0.3 parts per million. So we have some spring fed into our lake.
okay. Thanks, Roger.
Ma'am.
All right, last question. Why do you fluoridate? Frank, you want to take that one first?
I was gonna say the council made me do it, but no.
No.
No, I mean, I tell you what, I learned a lot, you know, when I came in here and we did what we did. I tell you, it really just, it's really a benefit to the community that we take care of, you know, and, you know, like Roger was saying, his comes out to about 2 cents a day. We all spend more than 2 cents, 5 cents a day, you know, and if you can do that to help a kid out or help an elderly kid out that can't make it to the dentist, you know, it's worth it, you know. I mean, that's why we do it. You know, tell you what, I learned a lot, you know, when I went through this process and became this director and stuff. And I'll tell you what, I'll do everything we can here in Park Hills to keep doing fluoride, you know, putting fluoride in and trying to help our community out. Or any other community, if there's any other communities out there that you want information or close to us, give me a call. I'll take you down to our plant and show you what we do. So,
Great. Thank you, Frank.
you're welcome.
That's why we're all here, to help each other out and you know, make life better for everybody else around us.
That's right.
Roger, why do you fluoridate?
Yes, ma'am. Well, I fluoridate because I believe in it. And I've had to explain to the city council before, because a couple residents have come and said that they wanted it discontinued. And I went to battle. Well, I wouldn't say battle, but I went to work informing the council more about it. And you stay in this business long enough, you learn that you have to train the city council every 2 years, because you get new ones on it every 2 years. and you got to re-inform them and reteach them how things work. And I've been doing this for 30 some years now. So I'm getting tired, but that's, that's the benefit to the kids. And, when I was young, they was just fluoride, fluoride was in its infancy because I was born the same year they started feeding fluoride.
Oh, okay.
So
It was meant to be that you would be adding fluoride then.
I guess. And, I grew up on a home well system and all. And even when I moved to town, we just pumped water out of a well straight to, straight into the pipeline with no meters. Everybody paid the same amount on the water bill, no matter how much you used. Boy, them days are gone.
Yeah.
But it's like I said, it's a benefit to the kids. It's a community service that the city can provide at very little cost. And like I said, we've got a no-touch system, so it's really not dangerous to my employees or anything as far as being hazardous. And if anybody would like to know a little more about our system, I'd be glad to explain it or show them to it. In fact, you all got some pictures of it, and it's really simple. So that's about it.
Okay. Thank you, Roger. Appreciate that. All right, David, why do you fluoridate?
Well, about the same thing. This community decided to fluoridate over 50 years ago, and it's my job as a chief operator to see to it that it does happen. So, and we supply the best water we can supply, and I do think by fluoridating, it benefits everybody.
Right, that it does. I know whenever I was little, I had asked my mom why her and my dad had so many cavities and I hardly had any cavities. And they said,
Yeah.
well, it's because we didn't have fluoride,
Right.
fluoride in the water and fluoride in our toothpaste, so it all makes a difference, that's for sure. So I appreciate what you guys do. It looks like we did have a question that came in. This is from, I guess, the American Fluoridation Society from AFS. Some people say that FSA is the most hazardous additive used in water plants. What would you three say to this? So who wants to take that one first?
I'll take it first if you don't
Okay.
mind.
Okay.
There ain't a chemical that we don't use that ain't hazardous, but the most hazardous would be gaseous chlorine, because it can take you down in a matter of seconds. Fluoride, if you handle it properly, there's really not much of a hazard. I mean, it off gases some, so it'll stain glass and make your nice clear glass look frosted and everything. But you wear your gloves, you wear your eye protection, and there's really, no other, it's no worse than handling some household chemicals that you got under your kitchen sink. Actually, you mix ammonia and something else in your bathroom stool to clean it, and it'll kill you dead. So there's precautions that you need to use, but if you use them correctly, it's no worse than any other chemical that we use.
Okay, thank you, Roger. Frank or David, you have anything to add to that?
It's all the same as Roger said. The fluorosilicic acid, we use 23%, which is a very dangerous chemical if you were to drink it straight out, of course. But we handle a lot more dangerous stuff, and it's our job to see to it that the optimum level is pumped out, and as long as we do that, it's safe. So, and that's why we keep our water plants secure, and nobody but certified operators are allowed to do anything in our plants.
Yeah. I agree.
Thank you.
I agree with Dave there. It's all in how you handle it. You got to be careful. Where you're, like Roger said, guys wear their gloves and transferring it, and you got to be careful because it is very dangerous. But we're feeding such minimum into, we feed over 8 million gallons a week, for what we're feeding it, and it's just very minimal. So
Sure, it's kind of like Tuka said at the beginning, anything is dangerous in certain amounts. So,
exactly.
so yeah. All right, thank you. Looks like we have another question. And there's some abbreviations in here, so I'm gonna assume what these abbreviations mean. But does FL2, I'm assuming fluoride, eat at the fluoride system and ruin it because that was one reason local community canceled fluoride? So does fluoride eat at your system and ruin it? I think is what the question mainly is.
Well, as far as the fluorosilicic acid, 23% is what we use. Like I said, as far as our equipment, no, I mean, I don't have any problems. Now, if you let the stuff spill on your concrete, it will etch the concrete. But you try to contain that and be cautious as you can and clean up any spills with the proper absorbent material. But no, as far as the chemical, as far as the equipment, I don't have any trouble with it. I do change my lines once a year, as I think Roger said earlier. But and the reason why I change them on the fluoride side is because that the tubing just kind of darkens over the year, but the tubing is not ate up or etched in any way. But it is kind of hard on concrete if you were to spill and leave it there. So that's about the only problem I have with it.
Okay, thank you.
Yeah, and if they're talking about out in the system, I don't think it bothers any of the pipes or any of the underground water lines. I've seen broken mains with fluoride in it and seen broken mains without fluoride, and there's no difference. So I don't believe that for to be a concern anyway.
Okay,
Yeah.
thanks, Frank. Roger?
Now, if you have a fluoride room that's not properly vented and gases and fluoride is this leaking, it will eat up anything that's concrete or iron. It will, it'll etch and just absolutely destroy it. Where we use all of the Schedule 80 plastic, no black iron lines, no galvanized, and you stay with the Schedule 80 and the stainless steel. Our room looks immaculate. You got some pictures of it, and we even fed it in the old 15-gallon carboys or the 155-pound ones, and we had to change them every few weeks and set one up on the scales and change the pumps and all. And yeah, you do spill a little bit, but you hose it down, you clean it up, you keep your vent going to the outside so that it don't build up any fumes in there to etch your windows or your equipment. So I would say maybe they quit feeding it for lack of attention or maintenance to their equipment.
All right, thank you, Roger. Okay, I don't see any more questions in the chat. I do want to add a little plug for the Office of Dental Health. Like I mentioned before, if there's any water operators out there, anybody else on the call who needs some answers about water fluoridation, please let our office know. Obviously, you can contact your local water operator if they do fluoridate the system. I'm sure they would be very happy to answer your questions, but the Office of Dental Health would be very happy to answer questions too. Office of Dental Health also has some funding opportunities available. I think Frank mentioned that they received some funding from us for some water equipment replacement and repair. So if there's anybody else out there who needs some for their water system, please let us know. Okay, that's all that I needed to say. That's all the plug for Office of Dental Health that I had there.
I'll give them a shout out. They do a very good job, and guys that other operators out there listening and stuff like that. If you need equipment, don't be afraid to ask. They're there. Gwen's a great lady to work with. She makes it very easy. thing. We did some paperwork and it wasn't a matter of time. There was brand new equipment sitting there. I mean, we had to do it one way or another. But you know, kind of take advantage of it. It's there, they'll help you. And it'll be better for your systems and your communities. So thanks again, Gwen.
Yeah, we're happy to help out. And we try to keep it as easy on you guys as possible. I know working with the state can be a little difficult at times, but we try to keep it as simple as we can. So appreciate that. I do believe Gwen is going to do some slides now. Her voice is back and forth. Hopefully she can make it through this without coughing, but Gwen, I will let you take over then.
Hi, everyone. So I will apologize up front. I sound pretty rough, but we should be able to get through this. I want you guys to get all of your CE hours through DNR. So I want to make sure that we can make that happen for you. So as you guys know, I'm Gwen Solentrup. I'm the Community Water Fluoridation Coordinator with the Office of Dental Health. I have been here a little bit over a year. I've been working in public health since 2013. So have been, around the block a few times with other areas. I've learned a lot, and thank you, Roger and Frank and David. It's been great working with all of you guys. So we appreciate you very much. So we'll get started. So I apologize if I can do this correctly. Okay. So dental professionals are not the only people with important roles to play in preventing tooth decay. So we have water operators who also play a crucial role in the fight to prevent tooth decay. They provide clean drinking water to residents, and in the public water systems where they add fluoride, they are providing an important public health initiative that helps prevent cavities. Before I go on, is everyone seeing this okay?
Yeah, we can see your slide and then the next slide and then your notes.
Okay, sorry. I don't have this one memorized, so you guys are gonna get to see the notes today. So just to point out a picture, this middle picture right here is the Marceline setup. So when Roger says hands-free, it is pretty well hands-free. So community water fluoridation began in Grand Rapids, Michigan. It was the first city in the United States that began adjusting the fluoride concentration in the public drinking water supply in 1945. And as of 2018, nearly 73% of the United States is served by public water systems and has access to fluoridated water within those systems. Our first city that actually started adding was St. Louis, Missouri. They began fluoridating in 1954, and they continue to fluoridate today. I apologize. This is not working right well. Okay. I am sorry for the issues that we're having here.
That's okay,
So-
Gwen. You should get an award for trying to speak when it hurts.
It's all right. So, yeah, okay. So additionally, in 2020, community water fluoridation celebrated their 75th anniversary in the United States. So we've been doing this for over 75 years now, and it's been proven that it works, it's effective, and it's safe. So I'm going to give you a definition of fluoride. Fluoridation is definition of fluoridation, not fluoride. Fluoridation is the precise adjustment of fluoride in the drinking water to a level optimal for the reduction of tooth decay. So you take the natural amount of fluoride in your water supply, then you add in the additive, and you reach the target rate of 0.7 parts per million or milligrams per liter. In Missouri, the average natural fluoride level is 0.2 to 0.23 parts per million. There are definitely areas that are higher and there are areas that are lower. We have some that are 0 concentration. We have areas that go up to and beyond the 2.0 parts per million. But on average, it's right around the 0.2 mark. For the CDC, the optimal range for water fluoridation is 0.6 milligrams per liter to 1.0 milligrams per liter. And 1 part per million is the same as saying 1 milligram per liter. So fluoride is a natural mineral, fluorine, that occurs in all water. The amount of fluoride in the water depends on the type of water. So surface water, rivers, lakes typically have lower concentrations of fluoride in the water at around 0.2 milligrams per liter, parts per million or less. Groundwater, or the deep wells that we have higher concentrations of fluoride, and it can range from 0.1 to over 5.0 parts per million. And then ocean water also has fluoride in it, even though it's salt water and we can't actually drink it without doing desalination on it. But it does have around 1.4 milligrams per liter parts per million of naturally occurring fluoride. And as I stated, Missouri does have naturally occurring pockets of areas that have fluoride levels that meet the adequate optimal range. So they do not add additional fluoride, they just pump their water straight out. As Roger had mentioned, they're around 0.3 parts per million naturally occurring. So, you know, they're going to add about 0.4 of the fluoride additive FSA to get up there to that optimal range. So there's several different regulations and statutes and governing bodies that watch what water systems are doing. So the Safe Drinking Water Act was passed by Congress in 1974, and there were amendments added in 1984 and 1996. Under the Safe Drinking Water Act, the EPA sets standards for drinking water quality and monitors states, local authorities, and water suppliers who enforce these standards. As part of this act, the EPA has set a maximum contaminant level, as well as treatment requirements for over 90 different contaminant levels in drinking water. As all of the water operators stated, and as you've probably heard, fluoride is not the only thing that's added to the water that is monitored. It's just a hot button. It's a hot topic that a lot of people, bring up. So the National Primary Drinking Water Regulation, these are standards and treatment techniques that public water systems must follow. And these regulations protect public health by limiting contaminant levels in drinking water. Anything in excess is going to cause health issues. So the EPA uses these regulations to monitor for microorganisms, disinfection byproducts, radionuclides, and organic and inorganic additives that are put into the water supply, such as chlorine and fluoride. Due to the rare locations where fluoride is naturally present in water at much higher levels, the EPA has established a maximum contaminant level for fluoride of 4.0 milligrams per liter. And the public water system should notify persons served as soon as practical, but no later than 30 days after the system learns of the violation. So if for some reason you had an issue with overfluoridation and you went over 4.0 parts per million, you need to make sure and let DNR know and get it out to the public that that has been an issue. Now, in addition to the maximum contaminant level, there's also a secondary regulations and a secondary contaminant level. So the National Secondary Drinking Water Regulations are guidelines to help public water systems manage their drinking water for issues not related to health, but more for taste, color, smell, some of those things. You turn on your sink and you think it smells like rotten eggs. So they're managing for those types of things. Water systems are not required to follow these water quality standards for the 15 contaminants, which include aluminum, chloride, color, copper, corrosivity, fluoride, foaming agents, iron, manganese, odor, pH, silver, sulfate, and total dissolved solids or zinc. But it is recommended that they follow them. So because of that, the EPA set a secondary maximum contaminant level of 2.0 milligrams per liter. It's not enforceable, but the EPA does require public water systems to notify people served if the average water levels exceed that secondary standard as soon as practical and no later than 12 months after it has been exceeded. So as Roger had mentioned, there is safety gear that is necessary to protect the water operators as they're using these chemicals and additives. With fluoride, the things that need to be used are recommended are neoprene gloves, a face shield, safety goggles, and a neoprene apron. So we want you guys to be safe, and we want you guys to be utilizing all of the items that you need to make sure that your safety is taken care of so that you can continue serving your customers. So when you're working with certain materials, ensure that you have that PPE available. And if you don't, please reach out to us. We are happy to help you guys get that taken care of. Also, you guys should have a containment system surrounding the fluoride where you're pumping that fluoride out of, whether that's a carboy, a tote, a bulk container. You can get a double lined wall container, and that would satisfy, or there's actual containment kits that you can put around those carboys and totes so that if there is a leak or a spill, it's not going to get out, etch the concrete, cause burns or damage to people or other items within the plant itself. So water system personnel have a primary job to provide clean drinking water to the public. If the system is fluoridating, personnel is tasked with maintaining the optimal level of 0.7 parts per million so that their community members will get the most benefit. They collect daily test samples along with DNR mandated test samples to ensure the optimal range of 0.6 to 1.0 parts per million is maintained. Personnel are required to perform this test daily, and the sample site should be rotated daily as well. We have some systems that have multiple injection points, so they would not test the same injection point over and over. They would want to spread that out to make sure that everything is working as it should be, and all of them are within the right range. So in Missouri, DNR requires quarterly samples to be sent into the lab for verification, and then those readings are then passed back to the water personnel at the systems. We also have a statute in Missouri that if you want to start any type of modification, starting, beginning fluoride, ending fluoride, changing to a new type of system to feed fluoride, you need to do what's called a 90-day notification process. And that process, I've listed the actual link on the slides. And I do not mind sharing the slide or sending out the link afterwards if we need to. But basically that statute says that you have to give the public notification 90 days prior to a final vote, whether you're going to stop adding fluoride, start adding fluoride, or even change how you're going to deliver the fluoride. Like with the new technology that's coming out, that's possibly something that we're going to have to consider with DNR. So at this point, if that's something that you're interested in doing, please go to this link and review that statute. It's also on our website and DNR's website, but it'll give you a lot of important information that you need to know. So the Office of Dental Health works in conjunction with DNR. DNR is the regulatory side. They monitor to ensure that you're fluoridating and at the proper levels. There's no over fluoridation, that you're being safe, you're wearing your PPE, that you have the containment systems, spill kits, all of that working. Our side is the education side. So we're the public health sector. We're going to provide you reasons why there's and the benefits of why you should be fluoridating. We offer technical assistance to help determine what might be causing the issues, such as outdated equipment. It's an insertion point on the raw water side instead of on the finished water side. It could just be a lack of understanding about fluoridation in general. DNR shares their test sample data with our office, and we actually input that data into the CDC's website. It's called WAFERS, that's the abbreviation for it. It's Water Fluoridation Reporting System. And we have to enter those in there, and based off of that, there's several awards that can be given. But if you guys are not performing at that 0.6 to 1.0 part per million, I may reach out to you to see if there's issues going on with the equipment, see if maybe there was a safety issue that came up, and help you guys try to work through that stuff. We also provide education about the benefits of water fluoridation, online training, which we have an hour online training available. There's also the flow training, the fluoridation online system training through the CDC that's available. We will do face-to-face meetings, and we have educational materials available that we can share with you. So as I mentioned, the data that we enter into WAFERS, there are some water fluoridation awards that you guys could qualify for. Charleston received a 50-year water fluoridation award this year. Park Hills received a reaffirmation award after they started the 90-day notification process to see if they wanted to continue fluoridation. They reaffirmed their commitment to public health and offering that to their community. So they received an award for that. But these are available to any system that fluoridates. Make sure you take your readings, make sure you're getting that information to DNR. So that way we can hopefully come out and visit you guys and provide you with an award for your continued efforts, because it is appreciated. So there's been over 3,000 scientific studies that have proven the safety and effectiveness of water fluoridation. In 2020, the 8 U.S. Public Health Service chief dental officers from 1981 to 2018 all signed a statement to reaffirm their support and commitment to community water fluoridation. So the basic guideline is it's an intervention to help prevent tooth decay. And that's for all ages. Doesn't matter your race, gender, socioeconomic status, what type of education you have. Everyone that is on that public water system has the benefit of receiving fluoridated water, which is going to help them prevent their cost and cavities and tooth decay from the line. So these are all issues that can be caused by tooth decay or caries, cavities. Those words are all interchangeable. Infection, pain, difficulty in chewing, poor weight gain, nutrition issues, concentration issues, crooked teeth, missed school and work hours. It's a predicator of caries later in life, and it's costly treatment. So that's money that those families don't have to put back into the community, spending it at their local stores if they're putting it into dental care. So tooth decay is the #1 chronic disease of childhood in America, even though tooth decay is almost always preventable. These are just some pictures of, what it can look like for a kiddo. There's health disparities in dental care in the US. Low-income children and children of color are more likely to have untreated decay due to lack of access to dental providers or funding to cover the dental care. So these high-risk groups are our primary target, and it's really easy to reach them when it's a community-wide effort, such as water fluoridation. Tooth pain can affect a person's ability to eat, sleep, speak, and socialize. And children with poor oral health are more likely to miss school and earn lower grades. According to the US Surgeon General's report in 2000, children miss more than 51 million hours of school annually because of oral health issues across the United States. And nearly all adults, about 96% age 65 years or older, have a cavity, and 1 in 5 have untreated tooth decay or have lost all of their teeth. So again, this is not just a childhood thing. Children pull on our heartstrings a little bit more, but this does affect your grandparents, aunts and uncles, things like that. So please keep that in mind. So when fluoridation began, in 1901, Frederick McKay established a dental practice in Colorado Springs, Colorado. He began treating patients, and he noticed they had a brown stain they referred to as the Colorado brown stain. It was difficult to polish off. This led Dr. McKay to deduct the stain must have occurred during the period of enamel formation and was caused by an environmental agent. Only lifelong residents had the stain, which meant anyone new to the area had not been affected, and the model enamel was referred to as dental fluorosis. In the 20s, Dr. McKay discovered the environmental factor causing the brown staining must be from the drinking water, which was supplied by deep wells with fluoride levels of 4.0 parts per million or higher. In 1928, he discovered the fluoride levels had led to some protection against cavities. And ultimately, this is where water fluoridation kind of gets its originations. He did sequential cross-sectional surveys in the early communities over a 13 to 15-year period, and caries was reduced by 50 to 70% among children. And some of those trials did include periodic physical exams of the children that were participating. And there were no adverse health effects that were detected then or now. So it is a safe practice. But here's some these are just some really, I thought, cool things. Extractions of first molars in young children were routine. They had 3 to 4 cavities each year, and full extractions and complete dentures were normal for adults, and they were given as high school graduation presents or dowries for new brides because they were so expensive. So just something to keep in mind. So fluoridated communities have 20 to 40% less tooth decay. Community water fluoridation helps prevent cavities an additional 25% beyond our current fluoridated products, such as toothpaste, mouthwash, fluoride varnish treatments that you get at the dentist office. And it is the single most effective intervention. It saves money. In Missouri, for every dollar spent on water fluoridation, it avoids an average $32 in dental care. So that's putting $32 back into the pockets in those households. Right now, we have 71.79% of the population of Missouri, or approximately 3.8 million people, that are on fluoridated water. So if we took that times that $32 saved in dental care, that means that just by fluoridating, we're saving Missourians $121 million a year in dental care. So the benefits last a lifetime, and it's something that we really need to keep doing. So fluoride is incorporated into the enamel of teeth as they are forming. It combines with phosphate and calcium to create a stronger surface and more resistant to decay causing acids. Earliest research hypothesized that fluoride affects enamel and inhibits dental caries only when incorporated into developing dental enamel or before the tooth erupts. The predominant effect is topical, or after the tooth erupts. The effect depends on fluoride being in the right amount in the right place at the right time. It works best when small amounts are maintained constantly in the mouth, specifically in dental plaque and saliva. So adults also benefit from fluoride, not only children. So it's important to remember it can have systemic benefits as well as topical benefits. There has been an uneven decline or disparity in tooth decay across the population. 80% of tooth decay is found in 25% of children aged 5 to 17 years old. So approximately 1 in 4 children aged 3 to 5 and 6 to 9 are living in poverty and have untreated tooth decay. Populations with increased risk or low socioeconomic status, low level of parental education, and little, if any, access to dental care. So as David and Frank had mentioned, they have a higher poverty level in their areas. So their children are going to be impacted quite a bit more than somebody who lives in a more affluent area. Community water fluoridation has been endorsed by over 100 key scientific and professional organizations. These are just a few. So it's not just something that we just say. It's actually been researched and is promoted by the CDC as one of the 10 greatest public health achievements of the 20th century. This is our US Surgeon General, Dr. Vivek H. Murthy. He's an MD with an MBA. And so he stated that water fluoridation is the best method for delivering fluoride to all community members, regardless of age, education, income level, or access to routine dental care. Fluoride's effectiveness in preventing tooth decay extends throughout one's life, resulting in fewer and less severe cavities. In fact, each generation born over the past 70 years has enjoyed better dental care than the one before it. That's the very essence of the American promise. So there's new oral health initiatives that are being developed daily and have been included in the Healthy People 2030. And those are guidelines that set goals for us to reach as a nation. So the target goal is 77.1% of all people across the US having access to fluoridated water. Right now, Missouri is 27th in the nation. That was as of 2016. We are currently at 71.79%, and we have 24.39% of our systems, which is only 379, that actually either currently fluoridate or have naturally occurring levels within the optimal range. And as Tuka had mentioned, there is new technology that is on the horizon. I'm not going to spend a lot of time on this right now because we are working with DNR to try to get this technology approved. But we do have the system that will be coming out. It is perfect for some of our smaller rural systems that are, that have to switch out those totes like once a week, creating more hazards for themselves. So as we work through that process, we will keep you guys up to date. This is our fluoridation training that we have. It is 1 hour, and it basically tells you how fluoride works, goes through the water system, and has a lot of information in there. It is approved through DNR for a 1 hour CEU for continuing education for water operators. So please feel free to access that on our website. The actual direct link is there, and that is the actual DNR number. So at the end of it, if you need to look it up that way. So that's all I have, and I apologize for the rough sounding voice and how quick I went through this. I don't want to take up any more of your guys' time, so thank you for being on to the call today and listening to us. We appreciate it.
Well, we're a little bit over on time, but if anyone has any questions, we want to give you an opportunity to ask those real quickly. I'm not seeing things in the chat at this point for questions. So while you're thinking about that, I want to say thank you to everyone for being here, and thank you to all of our presenters. And you all did just a fantastic job, and I will say I especially enjoyed hearing from Roger, Frank, and David. Thank you for the work you're doing locally. Really great and important to the community. And I just want to take a moment to say thanks for that. And thanks so much for your presentation today.
Thanks for having us.
Yeah, great. Let's see, we are getting very nice comments to everyone about the presentation. Okay, here is a question. What part does the trend of people buying bottled water play in the amount of fluoride they consume? Well, others might be able to answer that, but I would say, generally speaking, bottled water does not include fluoride. You have to look for it. There's sometimes one brand on the shelf that'll include fluoride. And so actually people are doing themselves a disservice. And I'll also reveal my bias. The United States is blessed with an awful lot of good public water systems, and you're wasting your money if you're going out and buying bottled water. People like Frank, Roger, and David are doing a good job making sure that you get good tap water and you will get fluoride in it. And so don't waste your money, but others may have comments to that. I think Tuka has put a link out there for you.
Yeah, so that's a link with the list of brands containing fluoride. It is not required for labels to include that information, but usually if you go to their website, they will have information on if that particular brand is fluoridated. The way to know also if it does not have fluoride is if it says it's been treated with reverse osmosis.
Yeah, and we got a good comment. Poor people cannot afford bottled water, and it's a more important group to reach.
I actually want to expand on that a little bit. So there is a kind of like a misconception too on who may be using bottled water or not. There are a lot of folks that actually, even if it's difficult to afford, they will choose bottled water because it's a cultural practice, or maybe they generationally did not have access to clean water systems. So they will choose bottled water because they think it's safer or cleaner. And that involves a lot of messaging. I know Texas had a big campaign to promote drinking community water. And that's separate from fluoride. It's not a concern about the fluoride necessarily. It's just not being sure about water treatment. So if there's any sort of public health messaging about choosing water and about public water as a safe option, that's definitely what we've seen some communities do. I also wanted to clarify, I know this isn't the case with our panel today, but we definitely also always recommend for the water to be safe, safe to drink, treated well, and then, as an extra benefit to add fluoride. So if there's a water system that has, that isn't able to treat their water, we're not going to then say, okay, and add fluoride anyway, because we don't want folks drinking water that may not be safe to drink. But again, that's not the case with us today, but it's always a first than situation when it comes to fluoride.
So I am not seeing any additional questions, and well, there is a comment about this Gwen's slides. Gwen, if you'll get those to us, we'll be happy to shoot them out to everybody that has been in attendance today, so they'll have those. And thanks for doing that. And also, just to remind you all, there will be a recording available of this webinar, and we'll get that up on our website. It usually takes us a little while to download it and save it and get it out there, but hopefully within a week or so we'll have that out there. So just check our website. You can go back and skip through and see the slides that way as well. And as a reminder, there will be a survey coming out about the webinar. Please fill that out. That helps us make our improvements to the educational and awareness events that we do, and we certainly need that information. It's also necessary for the dental CEUs, and we have put this in several emails that have gone out, but dental CEUs will take a while to process by the MPCA, so probably in 3 weeks or so, you will get information about your CEUs. So with that, I want to again thank everyone for being here. We're over quite a bit, so I'm going to go ahead and cut it off. But thank you also very much for sharing your expertise and for everyone's attention today. And I hope you all have a great rest of your day. So goodbye.